Welcome to Mountain Stream TV. Today is August 8th, 2025. I'm Ron Arps. Today's program is another in our series about safety net programs in Jackson County. Our mission in this series is to present information about organizations and government agencies in the county that provide assistance to people in our community in the areas of health, nutrition, education, and housing. Another focus in our conversation today will be about how these programs are changing due to the cutbacks in funding and staffing at the federal level and the new budget that was just passed in Congress. Today we have with us Gretta Worley. She's the executive director of HERE in Jackson County. Thank you for coming in today.
Thank you for inviting me. I appreciate it.
So we'd like to hear about your organization and the work that all of you at HERE do for helping people in the county find housing and for finding shelter for homeless people.
Sure. Well, let me first start by saying that HERE is an acronym for Housing, Equity, Resources, and Education.
I wondered about that.
At HERE, we have several different programs that we provide to those that are living unsheltered to help them become stable and get into permanent housing. The folks that we help have to be literally homeless. And what that means is their overnight residence must be a place that's not meant for human habitation. They can be on a park bench, in a tent, in a vehicle, in an abandoned building, or they can be in a home that has no running water or electricity. All those things are considered a place not meant for human habitation. Mm-hmm. If you are staying in a motel that is being paid for by another agency or a church, that also considers you to be homeless. However, if you're paying for it yourself, the state of North Carolina tells us that you're not homeless. Mm-hmm. So that's how our program works. Those are the folks that we work with. We take referrals from anyone that wants to give us a referral. You can call me and say, hey, I know someone that's living homeless. Can I refer them to your program? Mm-hmm. Absolutely. We cover Region 1, and that means we work with 8 counties to help folks find housing. Haywood County, Jackson County, Macon County, Swain, which includes the Qualla boundary, Graham, Cherokee, Clay counties, and Madison County. Mm-hmm. I have no clue how Madison County got in with the far westernmost counties, but there they are. So for those 8 counties, we do provide housing services. But for just Jackson County alone, we provide shelter, emergency shelter on nights when the weather is forecasted to be 32 degrees or below. And we also provide street outreach. What street outreach does is we go out into the community, we meet those who are unhoused where they're at. And when I say where they're at, I don't mean at their campsite or in their vehicle, but I mean where they're at in their journey. We're not trying to push them into housing because they may not be ready for that, but we're there to assist them along the way. We provide them with tents, sleeping bags. If they have medication needs, we pay for their medication. We provide them trolley and transit tickets, hygiene products, food, water, whatever it is that they need to be stable at that moment, then that's what we provide for them. Mm-hmm. The street outreach worker is the face of our agency, and that person is Paul Phillips. He does a wonderful job. He is so passionate about serving those who are living unsheltered. And not only does he work with those in the community that are unsheltered, he also goes out and talks to the business owners on Main Street, or the sheriff's department, or the police department, the hospital. We want those folks to call us first if they're having an issue with someone who is living unsheltered, instead of calling the police first. Because it may be something that we can assist with, and not only does that keep them out of jail, it saves taxpayers money, because every time we put someone in, every time someone goes to jail, of course, that's our taxpayer money being used. And it also, by us being able to provide them with money to buy their medications, that also prevents them from using the emergency room quite so often. So that is that one aspect. The next aspect would be the shelter. When here in Jackson County was founded in 2018, they met with the county commissioners, who agreed to provide funding to our agency under one condition. And that condition was that shelter be only for those folks who are in Jackson County, from Jackson County. There's this huge myth that we have all these people coming from other counties or other states or other cities to be homeless in Jackson County, and that cannot be further from the truth. Whenever we put someone into shelter, we vet that person. Either they have an ID, or if they're working with other agencies, we call those agencies and verify. Or for some of them, they've been around since I've been here for 5 years. So we know that they're homeless, or we see them out on the street and we know they're homeless, and we know that they are from Jackson County. Now, I'm not a hard nose and say, I'm not going to put you in shelter if you're passing through and it's cold outside and your car breaks down and you have nowhere to go and you have no money. I'll put you in shelter for a couple of days until we can help you get to where you need to go. Shelter for us, since we do not have a congregate brick and mortar shelter, is the motel model. And really, that's not something that is sustainable. We did have University Inn providing us with a lot of rooms until Jay Patel sold University Inn. So that took away all those rooms. So we contract with Economy Inn, but they only can provide us maybe 5 rooms, and they're usually single rooms. So where do we put all these other folks?
How many would that be?
Well, if they're all single rooms, we're only putting 5 people up.
Yes.
Unless there's a couple or a mother and a child or something like that. We have a couple of other hotels that work with us outside of Silva city limits, down in Whittier. They're still in Jackson County. So now we've got to make sure that our clients have a way to get there. So we provide them transportation to get there. So they have no transportation, so how they're going to eat. So on the nights when the community table is open, we have volunteers that take food to them. When community table is closed, we purchase food, and either someone volunteers to take it or our staff takes it to them. So once that temperature is forecasted to be 32 or below, we open. It can be forecast to be 32 and below for 87 straight days. And those 87 straight days, those folks stay in shelter. They do not have to leave during the day and come back. That's just that gets to be, hard to do in a motel.
Yeah.
And we have a waiting list. We are at the mercy of the motel owner. If they call and say, hey, I've got a person in room 8 that is acting up, they're letting everybody in, the room's a mess, they're not doing anything that we're asking them to do, so we're going to have to ask them to leave, then I have no choice but to tell them they have to leave or else risk us not having rooms for other folks. So when they leave, then where do they go? They're back out in the cold all over again because we don't have a shelter. If we had a shelter, we could eliminate those kind of things. You know, we may have to tell someone, hey, you can't be here tonight because you're acting up, but we'll see you tomorrow if we had a shelter. So those are the kind of things that we deal with. We have what's called rapid rehousing, and we have, that's where we help our clients find housing. And we have what's called the fair market rent. Every county in America has fair market rent. And whenever we find something for them, it has to fall within that fair market rent. If fair market rent is $967 and they find something that's $1,000, we can't pay the $967 and they pay the rest. That's not how it works. It has to fall within
Oh,
that
that's interesting.
frame.
And you're talking about a month, right?
Per month. I don't have it on me, but when I say fair market rent is not anywhere close to what the rent people want, it's not.
Yeah.
I think a one bedroom in Jackson County is something like $963 is fair market rent. And you usually don't find something one bedroom in Jackson County for less than $1,200. So it's really, really hard for us to find them someplace to stay. But once we do, we have the ability to pay their monthly rent for them up to 24 months while they're working to become self-sustaining. So that gives them the opportunity to get a job, apply for disability, save their money. But we don't tell them, hey, we can pay it for 24 months, because as soon as you say that, then they're going to kick back and enjoy somebody else paying their rent for them for a while. So, you know, every 3 months, you know, we go back, we reevaluate. We're trying to teach them how to job search, how to budget, those kind of things, so that they can be self-sustaining. We have rapid rehousing through the Department of Health and Human Services, which we call ESG, the Emergency Solution Grant. We get money from them for rapid rehousing, and also through the Back at Home program for rapid rehousing. The Back at Home program has typically always been for disaster relief. Not so much right now with this program, but the difference is fair market rent plus 10%. They can add 10% to it. They can pay their rent for 24 months plus their utilities. We can't, only thing that ESG rapid rehousing can do is pay utility deposits. So I know it's so many different things, and people can't understand why one can do one thing and how one can do the other, and how do you figure out who goes where, and it's always so hard to try to explain to people what we do, because I can explain it over and over, and a lot of people have a hard time understanding.
Yeah, government programs seem to be very complicated.
They always are. But I did write a grant, and through the generosity of the Evergreen Foundation, I was able to hire a SOAR benefit specialist. And what that means is SOAR, another acronym, SSI, SSDI, Outreach, Access, and Recovery. And that is for people who are homeless or at imminent risk of becoming homeless to get their Social Security disability. So we have someone that is dedicated to helping them gather all their records, helping them fill out all their paperwork. We submit it. And, you know, usually when someone applies for disability, they're denied 2-3 times. When you do it through SOAR, you're normally not denied, and you normally find out that you have been approved within 180 days. So that's a game changer for a lot of people. That that maybe don't know how to apply for disability or have applied for disability and they've been denied. They come to us and then, boom, they have
Yeah.
they're getting their disability.
Yeah, I've been reading about how when some of these programs are like Medicaid are adding work requirements, but the thing that keeps people out of the program is the paperwork.
Right.
So it's really important to have somebody who knows how to do all that paperwork to help them.
Triana, she is our SOAR specialist. She had, all these classes that she had to take. She had to become licensed, and she had to go through the Social Security Administration to get clearance. So it was took a while, but she's doing a tremendous job.
Mm-hmm. And I read on your website that you have a aspect of all this called case management. Can you tell me a little bit more about that?
Well, our caseworkers try to meet with their clients at least every week, but let's remember, if you're not housed and you're unsheltered, it's hard to find people. They don't always have cell phones, or if they do have cell phones, they have a lot of times have to be Wi-Fi, where they can get Wi-Fi to get a phone call or whatnot. So it's sometimes hard for them to find them. But they sit with them, they work on goals and budgeting and how can we get you stable? What, do you have to stay in Jackson County? Are you willing to move? Are you have children that are going to come live with you? It's all aspects of everything that's going on with them, trying to manage those things to get them to where they're stable. That's our whole thing. We want to get people housed and them stable.
Mm-hmm.
So they work with, and right now, our Back at Home team, we have 3 case managers, and there's 75 clients in the Back at Home program. ESG, Rapid Rehousing, depends on how much funding we receive, how many people we can work with at one time. Currently, we're working with 8 folks there. I can't tell you how many people's in street outreach. Every day it seems like we're getting phone calls from someone saying, hey, I'm sleeping in my vehicle, can you help me?
Yes, housing is such a problem everywhere these days.
It is, and I don't know if you're familiar with the executive order that the president just signed, but he seeks to eliminate housing first. And housing first is the gold standard throughout the country of getting people housed. And what housing first is just what it says. You get people into housing first, and then we concentrate on getting them mental health help, substance abuse help, employment, because I like to use myself as an example. I'm terrified of the dark. I'm terrified of snakes. I don't like birds. I've never camped ever in my life, never slept outside. So let's say something happens today and I lose my job and I find that I can't pay my electric and I can't pay my water. So now I'm out. I'm homeless. So at some point I've got to find some kind of shelter. So if I'm in an abandoned building, there's possibly rats and snakes in that abandoned building. There's no power, so it's going to be dark at night. Or if I'm outside, it's dark. There's going to be things crawling, so I'm going to be worried about those things. So I can't sleep. And if I'm by myself, I really have no one to talk to. So at some point, I'm going to start to get anxious. So now it's starting to affect my mental health. I'm going to start talking to myself probably because I have no contact with other folks or at night. I mean, during the daytime, you see people. And I'm terrified, again, that something's crawling. Again, that anxiety. So at some point, somebody may say, well, hey, I have something that can help you sleep. So they give me a little bit of whatever it is that they're smoking or snorting or injecting or taking. And hey, it helped me sleep. Slept pretty good last night. So I think I'm going to try that again tonight so I can sleep tonight. And again tomorrow night and the next night and the next night. So now I'm addicted. And not only that, my mental health is not stable anymore. I'm not homeless because of those things, but those things are now affecting my homelessness. And I think a lot of people think that people are homeless because of addiction or mental health, but that's not always true. You can just be homeless. Everything was great in your life 3 days ago, and now you're homeless, and all these other things are going to start to affect you.
Yeah, I can see where that would be the case.
Yeah, and I don't think a lot of people don't put themselves in those shoes, and I don't think I ever did that until I started this position.
Mm-hmm. But then by providing of a place to be that's stable, you can work on all that other stuff.
Now you're stable, so now you have some place to put your medication. It's not going to get rained on. It's not going to get stolen. It's not going to get lost. Now you can go take a shower. You're clean. You got some clean clothes you can put on. You can go look for a job. Or now you've got a calendar and you can kind of figure out what day it is, because even us sometimes we say, what day is it? So if you're outside, all your
Sure.
days are starting to run together. So now you're starting to you're more stable. So you can say, hey, I have a doctor's appointment tomorrow at 4:00, because you can remember it. You've gotten it written down somewhere, and it didn't get rained on, or it didn't get lost, or it didn't get stolen. So those are things that people don't think about.
Mm-hmm.
Do you have an ID? Do you have your birth certificate? We need those things to get you a home. Well, everything I have is in my backpack. So my ID's someone's taken my ID. I've lost my ID. Here's my birth certificate, but you can't read it because it's been rained on so many times. All the inks. So those are just things that I don't think people really think about and consider.
Yeah, I would never have thought about all that.
Yeah. It's taken me a while to get to that. If you just come in and start working for me tomorrow, there's going to be things that you're going to be like, oh, I never thought about that. And even now, for me, after 5 years, I still say, I never thought about that.
Mm-hmm.
So those are the things that we do. And, with that executive order, if it comes to fruition, it's not just going to affect how we work with people, it's going to affect people's lives. And that's the main thing that we need to take away from this. It's going to affect people's lives. He's talking about institutionalizing folks who have mental illness or substance abuse issues. Well, we're rural. Where are you going to put those folks at? What it's going to do is drive folks deeper into the woods. They're going to be afraid to come out and seek services. So they're going to be hungry. They're going to be sick, and they're going to be afraid to come out because they don't know what. It's almost going to be like ICE going to find other folks. It's somebody looking for us to put us in an institution. So it's really, I think it will really affect people and their lives and their mental stability.
I'm sure it will.
So, if funding is cut for us federally, that means that the only thing we may be able to do is shelter and street outreach. Limited. Jackson County is our biggest funder. It's where we get most of our funding from, is Jackson County. And we also get a lot from the community donations. So with that funding from Jackson County and community donations, that will be how we would do our shelter and street outreach, but we wouldn't have money available to put people into housing.
So do you get any federal grants?
We do. North Carolina Department of Health and Human Services, they get federal money, they get HUD money. And HUD gives them X number of millions of dollars, and then different agencies apply, and then they get money from them. I just did a grant for calendar year 26 for rapid rehousing and street outreach and shelter, and conditionally it's $121,000, I believe, that we've been awarded. So hopefully there'll be no cuts and we'll get that $121,000. The Back at Home program is also federal money, and that program was set to run for 3 years, and so our third year will be ending September 30th, 2026. So there's federal dollars there as well.
And so far, all that money is still coming through.
Still coming through.
All right. Yes, fingers crossed,
Fingers
that's for
crossed.
sure. I had a question about, you talk about in winter when the temperature gets down to 32, you can house people and in temporary housing. And what about in the summer now that it's getting so hot? Do you have any special ways of helping people through the heat?
No funding. No funding. Again, I had someone call and say, it's so hot, can you put me in a hotel room so I can cool down? But the moment that I put her in, because they're all so connected, I'm going to get 15 more phone calls that same day. Well, you put Sharon in, how come you can't put me in? Or you put Paul in, how come you can't put me in? So we just do not have the funding for that. I wish we did. But then again, if we had a year-round brick and mortar congregate shelter, that wouldn't be an issue.
Is there any possibility of that?
I presented to the Jackson County Commissioners along with the county manager last year, and nothing. They didn't even contact me back and say, thank you for coming over and speaking with us, but at this time we can't help. I didn't get anything back. And so when I reached out to the county commissioner, he just said, you might want to include that in your grant request. But, you know, and I'm all for everything that the commissioners have done. I think they've done some great things. Our furry friends, I'm all for them having a great place to play and roam, and people go find their forever pet. Scott Furrett should be a pet in my opinion, so I'm all for that. And I'm all for the Center for Domestic Peace. I think men and women and children that have been battered and abused, they should have a safe place to go, definitely. And they just bought the Webster daycare that they're going to lease out for more child care. That's great, because that helps people stay stable and not fall into homelessness.
Right.
Or, you know, helps their children to grow and develop. That's great. I'm all for all of that. And I think I just saw something in the paper where they're doing something else. I can't remember. Oh, that's with the substance abuse problem. Great. I'm all for that too. All for all of those things. All of those things are great. And someone who works in a nonprofit, that runs a nonprofit, we have a heart for everybody, not just what we're doing. We're in nonprofit work because we see the big picture, not just the agency or the program that we're working with, but we see the big picture. So I'm all for all of those things. I think all of those things are great. My question just is, when are the commissioners going to feel like that those who are most vulnerable among us are going to get the same kind of help that everybody else is getting? I've got an elderly lady that's in her 70s that when it's not below freezing, she's out here at the library sleeping on the park benches. So, or the benches out here at the library. So it's an issue. It's a problem. No one that's 70 years old should be sleeping outside, ever.
That's for sure.
Ever. So. At one point, we had extra funding, and we did have emergency shelter for up to 30 days. It didn't matter what the temperature was. It was for elderly and parents with small children. It gave those children, for me, children, the opportunity to be somewhere inside, be safe, be able to take a bath, to go to school, to be able to do their homework. And you go to school and no one knows that you're homeless because you're clean, you smell good, and nobody's bullying you. But when you have to think about those things, because all someone has to do is get a sniff that you may be homeless, and then you could be bullied. So that was like a safe haven for them. And as long as their parents were working with us to try to become stable and doing everything that we asked them to do about employment and looking for housing, and hey Greta, I went to these 4 places today. This is the landlord that I spoke to. This is what they told me. This is their phone number. If you need to call them, you can. As long as they're trying, they could stay past that 30 days. Same thing with those who were elderly and disabled. They do not need to be out when it's 98 degrees, and they don't need to be out when it's 36 degrees. Because for me, I don't know the difference between 32 and 36. It's all cold.
It's cold.
So, but we no longer have funding for that. So that program went away.
Well, it sounds like you're doing an amazing amount of stuff with the funding that you have and the people that you have.
We have an amazing staff of folks that are committed, they are passionate, and they love what they do. I think our staff goes above and beyond. I'm there usually in the office at some point 7 days a week doing something or the other. It might be writing a grant, going over case notes or that kind of thing, but I'm there usually 7 days, and that's just because I'm dedicated to the folks that we're working with.
Yeah, I've been struck by that, with the other people that we've talked to also, people who are in the safety net agencies really have a lot of passion for their work. And they just put in a lot of extra time. And
I think that there's some part of our life that drew us to this kind of work, to work with the public, for those who are less fortunate than others. And, I don't care if I'm working with animals, because I love animals. I can't watch the commercials on television, the ASPCA commercial, because I'm crying, so I always turn the channel. So there's always some reason, we always have some reason why we're doing what we're doing.
I guess that kind of lets me segue into asking you about volunteers. Can you use volunteers in your work, and what kind of opportunities do you have for people who would like to help?
We do not have a whole lot of volunteer opportunities. We do have volunteers that deliver food during the winter months when we have folks sheltered. But I've learned that those same folks are there year after year. They've been the same folks for the same 5 years that I've been there. Very seldom do they tell us, hey, I can't do it this year. Because they'll start calling us in October saying, do I still have Tuesday night? Do I still have Monday night? Every January, I believe it's the 4th Wednesday, most possibly it's Wednesday, we do what's called pit night, and that's point in time. And we go out around 10 p.m., and we're looking for folks who are homeless. And we're counting them to see how many folks are in each county. It's all over the country. And then we submit our data to the state, who then submits it to the federal agencies. And that's a lot of the ways how we get our funding, is through that point in time count. So that's an opportunity for volunteers as well. We had some volunteers several months ago that cleaned out our storage unit, because we get a lot of donations of mattresses and furniture and that kind of thing, and so we stick it all in our storage unit. So we had had some volunteers that came out and they organized our storage unit so we could actually walk through it. That was great. And just a month ago or so, we had a group come, and on Wednesday, they served the unsheltered at the park because that's the day that community tables closed. So they called us and they coordinated with us, and we had staff to go over and help them, and they served those that were unsheltered, and even those that stopped by. So,
That's great.
and right now we've been doing a cooling station with our staff. Now that would have been something great, that if we had volunteers that could go set up and man the cooling station so our staff could concentrate on doing other things. But our street outreach coordinator, Paul, he was there for the entire week, and each day, Monday through Thursday, we had a different case manager to go to another location and set up. So, and we didn't require folks to be in shelter, just anyone that was hot out and needed. We had water, Gatorade, cooling towels, mosquito repellent, sunscreen. We had the whole, anything that you may need on a hot day.
So how do people find out about that?
Well, our webpage is being rebuilt and redesigned, so we will post a lot of things there. We do have a Facebook page here in Jackson County. I post on the Facebook page, and my door swings open. People can stop by our office anytime they would like, or just call us.
So what's your web page?
Here in JacksonCounty.org.
And well, actually, I looked at that. I didn't remember what the name of it was, but I thought it was a really good website. It had a lot of information, and it was easy to understand.
Bill Graham is actually getting ready to redesign it for me, so we can put in more information about each program. Just because we're growing and our programs are changing, we want to be people to be able to know what all that we have to offer and how we could help.
Okay. And people can call?
828-477-4946. Office hours are 10 to 5, Monday through Thursday through the end of September, and then we go into cold season, get ready for winter. So from October 1 through March 30, we're Monday through Friday.
Okay. And your Facebook page?
Here in Jackson County.
Okay, great. How about your physical location?
We're located in downtown Silva. Our address is 563 West Main Street. We are directly across the street from Black Balsam Outdoors, and we're upstairs above the Wild Kitchen. So here's the Wild Kitchen, here's Diane, Cheryl, Law, and there's a little enclave with double doors, and we're through those double doors up those stairs. So.
Okay. And you have to ring the bell, right?
Have to ring the bell to get in.
Okay, yeah. All right. Is there anything else you'd like to say while we're here?
We love donations.
Oh, I forgot about that one.
and it doesn't have to be the kind that folds. We take the kind that jingles. We take mattresses, furniture, I don't know, hygiene kits. We love when folks care enough about those that we work with to give to us.
Okay.
Because if not for the community, there are a lot of things that we probably would not be able to do.
All right. Well, thank you very much for coming today and explaining all this. I really had no idea about the homeless situation in Jackson County. It's just not something that, I'm very aware of, but I'm sure it's a much bigger, not really, well, it is a problem than I have any idea about.
Well, I can tell you that we spent almost $100,000 between November 1st and March 30th on shelter alone.
My. That's a big number.
It's a huge number. That's a huge number. You know, $100,000, if we had a brick and mortar shelter, could sustain us probably for 2 years. Um,
Hmm.
but we're giving it away. I don't want to say giving it away. We're giving back to the economy by, or the Jackson County economy by using the area motels. But at the end of the season, all we have are paper receipts and really nothing tangible. We've made sure people weren't cold, but with that money that we were spending to make sure folks weren't cold, we could have a building, you know, that money that we were paying per night, per person, could go into that
Right.
building where they could have someplace to be year round.
Right. I guess I'm just curious, what kind of a building would you like to see?
Well, I'm one of those people who have lofty dreams, but right now, if I could just have a building that I could have enough space to put men in one section, women in one section, and families in another section with dedicated bathrooms for each. And in the family room, I think families should be private, so, you know, 4 rooms at least for 4 families. I would be thrilled. I also would like to do a resource center where it's open all week, 7 days a week. It doesn't have to be open late at night, but where they can come in, they can read, they can use the computers to search for jobs, they can get a cup of coffee, they can watch a little television just to stay warm, just some place that they can come in and try to, again, get to the point that they need to be stable.
Mhm.
So maybe they don't want to come to the library because they know the people at the library may be judging them. So they could go into this resource center where they know that no one's going to judge them because everybody there is just like they are, living that same life that they're living.
Mhm.
So
Well, that's something we need to strive for in the future.
it is. We have. Let me tell a story. We,
I like your stories.
We have a client who is now housed. I worked with this client, I guess, 5 years ago when I first started at here. And this client disappeared, but I was reunited with them during Helene. They were out at the shelter at the Department on Aging. And Eddie Wells and Chris Weatherford called me and said, we have some folks out here that are homeless. Can you come out and what can you do for them? So I was able to put them in shelter because, you know, everything was shut down and water was rising. And so once that shelter closed, we were able to put them in shelter. We had some donations, so we were able to put them in shelter. And this particular gentleman was telling me his story of how he had been housed, and he is diabetic, and he went into a diabetic coma. And they had to airlift him from his place of residence in Cherokee to Mission. And someone called the landlord and told the landlord that he had overdosed. So the landlord evicted him, even though he was in the hospital, had hospital records that showed that he had been in a hospital because of his diabetes. So I gave he and his brother, I gave them both tents, I got them both cell phones, got them some minutes, and they went into the woods. Well, while they were in the woods, he went into a diabetic coma again. So his brother was able to drag him out of the woods, but because we had gotten him a cell phone, that saved time. He was able to call 911. He didn't have to go run and look and hope somebody could find him, you know, flag someone down to use a phone or something. While he was in the hospital, we worked double time, and we've gotten him housed. And he's been stably housed since the first of the year. And so those are the kind of success stories that we like, when we know that we've gone above and beyond to try to help someone get housed. You know, everybody in town knows the lady that they would see her standing in the middle of the highway, or she's walking up and down the streets cussing because her mental health is so bad, or she was taking a shower. I believe at United Christian Ministries, half unclothed outside, mental health. You know, she wanted to shower, and we worked so tirelessly. Us, DSS, Chief Hatton with the police department, to try to get her the services that she needed. But because her mental health was so bad, we were not able to get her any of those services. She had an ulcer on her leg that got so bad that we finally were able to talk her to go to the go into the hospital. Between us and Chief Hatton, we finally talked her into going to the hospital. Where, had she not gone, she may have lost her leg.
Mm-hmm.
But thankfully, while she was there, she was able to get into a group home. And now she's back with her, in the same state with her sister now. So she's no longer living here where it was home for her for years, but she's at least with a loved one. And I feel like even though we weren't able to get her housing, we helped through the steps to get her to where she is now.
Mm-hmm.
So we just want people to have stable outcomes.
Right.
I don't want to sleep outside. You don't want to sleep outside. So I don't know why anybody would think it's okay for other folks to sleep outside.
Well, I'm glad you're here to help them. And
We try, and again, you know, we do more than the housing. We have food. We have food in the office, so we feed them if they're hungry, or we're happy to, we have frozen food or shelf-stable food, so we'll warm it up, whatever we have to do. We have a big conference table they can sit there to eat. They can take it with them. We're happy to fix them, the goodie bags to take with them. We always have something, even if it's just a bag of chips and some crackers. We always have something in the office for them when they come if they're hungry.
good to know. I may come in one day.
You're more than welcome. But, it doesn't pull on your heartstrings quite as much as it does when you have a 2-year-old that is sitting there telling their mama they're hungry. Or we had someone that come in a few weeks ago, a mother and her 7-year-old who've been homeless since the winter, and the only clothes the daughter had are winter clothes. And my case manager said, he said if she said it once, she said it at least 10 times that she was hot, because the only clothes she had was winter clothes. So, we made sure she had summer clothes.
Mm-hmm.
So those kind of things. Nothing pulls on your heartstrings like children and those in advanced years with all the wisdom.
Well, thank you very much for sharing
thank you
all
for
this
having
with
me.
us today.
Having me. I know that was a lot of information, and people are welcome to call the office, and I'll be happy to try to break it down as simple as I can, because I know it's very hard to understand.
Mm-hmm. Well, I think it's good that that you can explain things, in this kind of a format. It means a lot more to people, I think, to hear you actually talk about it than to, read something and
Right.
to hear your passion and your feeling for the situation that people are in.
Like I said, it's hard. I had someone call yesterday, I need housing. And so, of course, my first question is, where did you sleep last night? And, well, we're in our house, but we're going to lose our house, so I need you to help me get housing. And then I have to say, We only help those who are literally homeless. And the husband's in the background screaming and yelling, but we're going to be homeless. I understand that. And I wish there was something that I could do before you get to that point, but I'm the place that you come once you do get to that point. And it's hard for people to understand.
Yeah. The, are there other people? I noticed on your website you had a list of resources, other agencies and organizations. You know, are there people who could help somebody like that?
If you're searching for housing, at this point, I refer folks to mountain projects, but unless something's happened, the Jackson Haywood Mountain Projects Section 8 voucher system right now is on a wait list. So they're not actively taking applications, or if they are, people are being wait listed. They're not giving them out right now. We do work with Jackson Neighbors in Need for things like electric bills and utility bills and that kind of thing. Heat is a big thing. Or if they need something with utilities and they have children, I often refer them to DSS, because sometimes DSS can help folks with those things. And I always remind them, you being behind on your electric bill is not reason for DSS to take your children. Or you being homeless alone is not a reason for DSS to take your children. We have to remind them, because sometimes they get afraid that they're going to lose their children. And it has to be more than just you being homeless for you to lose your child. We work with United Christian Ministries. They used to help provide shelter services, but what I'm beginning to understand now is they're going strictly to food insecurity, and so they're just doing food. And then we work with Community Table, Blue Ridge Health, Appalachian Health Services.
Well, you have a good network.
We do. We love to collaborate.
That's great.
Because usually if they're to the point that they're seeing us, then they need other services besides just us. So we love to collaborate.
Well, thank you again for coming in today.
I appreciate it.
We really appreciate your being
Yes,
here.
thank you.